Hi everybody, Neil Kravitz here. At the last video, we talked about LDCs, or labially displaced canines. So for this video, let's talk about how I address PDCs, or palatally displaced canines. So a quick review on LDCs. I like to treat them early with overexpansion. The expander will have a buccal cantilever arm in case I need surgery. And if we do need surgical exposure, we're going to ask the surgeon for an apically positioned flap. Now, PDCs are much more common. They occur 85% of the time, but they're associated with genetics. So we're looking for other genetic dental anomalies, specifically peg lateral incisors, missing lateral incisors, missing mandibular second premolars, rotated premolars, missing wisdom teeth, delayed dental eruption, ankylosis of the deciduous posterior teeth. If we see these dental anomalies, we're thinking about a PDC. Now, I like to treat PDCs with an open exposure around the middle school years. So typically a 6th grade girl will come in, maybe around age 11 or 12. She'll have a palatally displaced canine, and I'll tell the family, listen, we don't need to start braces right away, but we do need to address this tooth right away. I will refer to the surgeon. They will extract tooth number H. They'll do an open exposure on tooth number 11, where the surgeon will remove the tissue and the bone to the CEJ, bond an eyelet on the canine, cover the tooth with barricade, and that's it. I will see the patient 4 to 6 months later. Once the tooth emerges in the mouth, during the second consultation, I'll remove the barricade, and then we'll begin treatment with braces. It's streamlined, it's simple, there's no tugging of the tooth, it's very easy. It is my preferred approach. Now, here's the kicker. What if a 14 or 15-year-old patient comes into our office with a palatally displaced canine? Now, PDCs typically do not ankylose. We're more concerned with ankylosis on LDCs. But for a PDC on an older patient, I will actively go after that canine. So we'll still do the open exposure, but we will put on a gold chain or an isoglide spring, and we'll actively begin treatment immediately following the surgery. So in review, for PDCs, I prefer an open exposure, ideally around the middle school age. I will let that tooth erupt autonomously. I will see them after 4 to 6 months post-surgery, and once the tooth emerges in the mouth, when I can remove that barricade, that's when I will begin orthodontic treatment. I hope this has helped. Thank you for subscribing to this channel. Thank you guys for supporting the JCO.